passing out CBD.
Yes, everyone open their mouths. It's gonna put CBD in everyone's mouth before we start.
So I just give it CBD.
Should I start? Sure. Okay. Well, hey everybody, I'm Shalisa. I'm the owner of Furry Faces CBD. I'm here to answer all of your questions about CBD today, so feel free to like pop in while I'm talking and everything. I'm gonna just tell you a little bit why I started doing this. So I have been working in the veterinary field for 25 years. I primarily work in emergency medicine. I've also worked in large animal. I actually had a horse accident and I was almost a life-ending accident, and I used cannabis to heal my body. And then while I was sick, my dog got sick. And he had really bad stomach problems, ulcerative colitis, he had arthritis, he had cancer, all of these things. And I was like, we have an endocannabinoid system. Pets have an endocannabinoid system. Let's see if it works. So I took him to the hospital. We did all the tests. We knew what was wrong with him and everything. We could see all the ulcers in the stomach lining. Gave me 3 months. I brought him back. Everything was gone. All the ulcers were gone. He had no bloody diarrhea, nothing like that. All of his pain was gone. His cancer was gone. It was amazing. So I decided that I'm going to quit working in the veterinary field, and this is what I'm doing full time. And the reason why I'm doing it full time is because there is a national gag order in place, and all veterinarians across the country, they're not allowed to talk about it or recommend it or get their license revoked. But in California, I helped get the laws changed that now in California, veterinarians can now talk about it and recommend it. The problem is that no one is helping to educate the pet professionals, the veterinary staff, and if veterinarians have time to look into this, they will, but we're trying to provide this information so that we can, the pet parents are the ones that are really driving the market because of the laws that were passed. So now I'm just trying to help facilitate veterinarians, pet professionals, and pet parents getting the correct information, because there are so many products on the market right now that are not well made, they're ineffective, or they actually could harm your pet. And so we want to make sure that I can tell you guys all the most important information, so when you look at a product, you would know whether or not you should purchase it or not. So I'm just gonna go, that we've already, let me try it again. So we actually have this on a screen share. Yeah. So that's perfect. Thank you. So, this is a really long presentation, and then what I'm gonna do is at the end, I have a QR code that you guys can all have, so you can like download it and look at it your time. I also have one specifically for the veterinarians that go into more things, so I can give that to you guys if you guys would like it. Okay, so basically we wanna talk about hemp and cannabis. We wanna make sure that everyone knows that hemp and cannabis are the same family, but they're two different plants. I'm gonna put this down so it doesn't happen. Sorry about that. So, like on Amazon, there's no hemp, there's only hemp being sold on Amazon. So if you go to Amazon, please don't buy your products, your CBD products. Please talk to your veterinarians or get a product out of the veterinary office, because Amazon only has hemp oil, and that does not have the wonderful CBD molecules in it that would help your pet. So cannabinoids, let's talk about cannabinoids really quickly. So CBDGA is what we call the mother cannabinoid of all cannabinoids. It's where all of our cannabinoids are derived from. And how we were to get those is by heating them up, and we get these different beautiful cannabinoids that we're going to use. And I'm going to talk about each and every single one of these briefly and how they work in the body, what metabolic pathways they use, and how we can use them to treat our pets. So CBD receptors, we have CB1, CB2 receptors, and these are all the places in the brain and the body that CBD can work to help your pet. And how CBD works, it works on a negative feedback loop. So negative feedback loop is, I use the example of you're hungry, your tummy is gonna rumble, your brain tells you to eat. You eat your food, goes in your tummy gets full, there's signals that send back to your brain to stop eating, you stop eating. So that's a negative feedback loop. So all of our body systems and pet systems work on a negative feedback loop. So CBD, how it works is it goes in and it helps that negative feedback loop to work properly in your pet's body. So if there's dysfunction or any dysregulation happening, it'll really help. Sorry. I don't have a laptop, you guys, so I always screen share everything, and I don't understand why this isn't working this time.
Maybe because it's on low power mode.
Okay, we'll try it. And so these are all the places in the brain that actually CBD works. So a lot of people ask me like, well, how does it work for my pet? Is it going to make them knock out? Is it going to make them be druggy, fall over? And I say, oh no, this goes into the brain, and these are all the places it's going to help bring a calm and anxiety down your dog. So I use the example of you take a deep breath and you relax and you exhale. That feeling is the feeling that you should be seeing in your dogs when it's CBD, a high quality CBD is working. They always want to know, is it working? How do I tell if it's working? That's the thing you want to see is their anxiety. You want to see that very sort of take a deep breath and relax. That's what we're seeing. That's how your dog is going to visualize the whole atmosphere he's in, okay? So we're going to move on to the next one. So this is going to talk about a little bit more. We have THC. I'm sure you guys are all familiar with THC. You know, we don't want that for our pets in large doses. We all know what happens. CBD is what we're talking about. These are all of the ways you can help metabolic pathways. I'm just going to leave these here for a minute. All of this stuff is cited. So if any doctors or people are interested, you can go into each and every single one of these. It will take you over to where I got the information from. There is an FDA-approved product on the market now for veterinarians. It's a synthetic CBD. There's a big thing about full spectrum or synthetic, which one we want to use. I'm going to go more for the full spectrum, but we do understand why they're using isolates in studies because they have to have some consistency. But in my research, I've been doing this for 10 years, you're going to want a full spectrum CBD that includes all of these cannabinoids because that means you're getting every part of the aspect of the plant. And it's really difficult to find, and that's why I created something that had everything included, so we're making sure your pet gets all of the good benefits from this natural plant. Also too, so we're going to talk about CBD isolates versus full benefits of full spectrum like we're talking about. A lot of times isolates, how they make them is just a CBD molecule and they'll take it out of the plant, they'll strip it down, and they'll turn it into like a white cocaine-like powder, and then they'll redissolve it into something, and that's how they use the CBD molecule. The problem with that is that you're missing all of the amazing things for their body. Flavonoids, terpenes, amino acids. These are all great for their joints, for their brain health, for their gut health. All of the things that we're going to be doing, like all the other doctors here, they're talking about bringing down inflammation and pain. And you're never going to get that unless you have a full spectrum CBD. So also too, the reason I want a full spectrum CBD is something called the entourage effect. The entourage effect is when all of the plant molecules work synergetically together to help the body be more bioavailable. It's also how we're going to get a really high quality therapeutic CBD. So these are some of the things that we're using them for. These are the medical things we're using. We're using it in cancer, we're using it in all kinds of pain, seizures. I see patients currently, and I have a really bad case. He has grand mal seizures, medication resistant, 5 to 6 minutes every 4 days. And after I worked with her, we're down to 30-second seizures every 40 to 50 days now. And when she does get the seizure, we put the CBD straight on her gums because our CBD is highly concentrated, so there's no aspiration possibility, and the seizures stop immediately. So this is something else that could be used to talk to the veterinarian in combination with drugs, or using it separate. As I said, always talk to your veterinarian if you're going to be taking off any medications, adding medications. So this is a really interesting one, drug interactions. Everyone's wondering, are there any drug interactions when it comes to CBD? Everyone will say, no, it's perfectly safe. But we don't, it's not true. It's not true. The things we want to make sure of. Chemotherapy, we've seen really good things. You can add it to their, it's great. Okay, sedatives, we want to be just super careful if we're using any sedatives because CBD can be sedative. So if your pet's on any other medications, please talk to your veterinarian. And also make sure you're watching out if you're adding or layering this onto it. Also to dogs that have kidney disease, heart disease, you want to be really careful with CBD with these two things. Always want to monitor your pet, make sure you're already probably getting your, every 3 months, 2 to 3 months, the lab work's already being done probably if you're on those medications. But we just want to be super careful, especially with those two things when it comes to pets with CBD. Probably more drug interactions. So as I said, you can go through this at your leisure. I have everything cited so you can go back and check it and just for more information. Cannabinoid ratios. Everyone, THC is actually a good thing, but in doses, okay? CBD and THC put together actually dilutes the psychoactive effect. So if it's a 1-to-1, so a A lot of times if I have really bad pain patients that I'm working with, I will do a special mixture of THC and CBD at the right dosage, and we're seeing really good pain control without any of the psychoactivity, because we could get THC toxicity, we have to be very careful about. And then if you go down the line, how we're utilizing the different cannabinoids here. Different cannabinoid ratios for when we're doing moderate pain, less pain, severe pain. So depending on what's going on, we can mix the ratios and change the cannabinoids to really help our patients. Also too, CBD has biphasic dosing, which is really interesting. So basically, the more you give, you see more benefits. It gives the maximum benefits up here, and then after that, you're gonna start seeing side effects, loose stool, and sleepiness or something like that. So each pet has their own unique metabolic dose. So what works for one pet may not work for another pet. So what I try to do is teach pet parents what to look for, look the signs and symptoms, give them a dose range to play with, and then have them monitor their pet, because they're the best person. They know exactly what their pet is doing, showing signs. So they're the best person to really kind of adjust the dosage, and then we're there to help them if they run into some problems. One of the major things that I see in most pet products that I'm not very happy about is the oil to CBD ratio is really high. And our pets have really sensitive stomachs. And so if we're gonna be adding this, we need to be really careful of the ratio, especially our older dogs. You know, so we eliminate all the oils out of our product, so it makes it super hyper concentrated, so that way you can adjust the dosing without affecting GI disorders, because we have so many pets with sensitive stomachs right now. So we did that. Also too, this is really important. The law is to protect the veterinary community. Okay, we have the assembly bill that passed that made it legal, and then we also have the newly enacted AB 1885, which then allows veterinarians now to talk about it in the medical, so you have a patient relationship, so you guys are completely safe talking about it now. So yay, you guys. And then one of the most important things that I tell pet parents when they're buying CBD, if this is not on the person's website, do not buy their product, because this tells you what's in the product. Are they testing for things? We want to know how much is in the product. Are they lying? Are they not telling the truth? I don't know how many products I've picked up and I've tested them personally. I'm like, whoa, this is really scary. So the most important things we want to test for, of course, are total cannabinoids, because we want to know what's in it. And then molds. Molds, we all know molds are bad for us, bad for neurological conditions, pet neurological conditions. And mold is the number one thing that grows on hemp that people cannot get rid of. So we want to make sure that there is no mold or mycotoxins, which are the toxins from the mold spores, in our CBD, as well as hemp is used in industrial to pull toxins from the soil. So your CBD could be heavily laden with heavy metals. And we all know heavy metals are really bad for us, and they're really bad for our dogs. So if you have a product that's laden with molds and heavy metals, and you're trying to beat inflammation, that's not going to work. So these are the main things that you want to see here on a pet product's website. And as I said, if you don't see this, don't buy it. Also too, lab accreditation is super important. Make sure that they have a lab accreditation like this. This means that they go in by the federal and state government and make sure that all the lab testing equipment is done properly. We also want to make sure the Department of Cannabis Control license is in there too, because we want to make sure that the state is regulating everything, because it's a really crazy place to be in CBD. There are so many bad products, people trying to make money off of, you know, your warmth or your dog or your child or whatever. So that's my main vision in doing this, is to really help pet parents and pet people have the most education possible and make really good educated decisions. So this is a really good one I talk about all the time, hemp oil versus CBD oil. It's not the same thing. Okay, hemp oil is made from the seeds of the hemp plant, which has barely any CBD in it. It's a good nutritional, you know, and maybe skin and coat, but we're not going to get the wonderful, powerful anti-inflammatory properties or the pain relieving properties that CBD is going to have. So please don't buy your product on Amazon. Just don't do that. Pet CBD extracts versus CBD oils. We already talked about that. Low oil, high concentration, 50 to 70 milligrams per mil. Most pet CBDs are around here, 10 to 30 or less. I just did a thing where I went into all the pet stores, PetSmart, Pet Food Express, I pictured all their products, and then I labeled exactly how much should be in each product to actually be effective for the pound or dog. Extraction methods, I'll go over them really quickly. This is really scary. They're starting to do Freon-based extraction now. It's going to be the latest and greatest. Everyone thinks that's what it is. And they also do ethanol and butane extraction. So we're getting ethanol, butane, and Freon left in the products. So we want to go with a CO2 extraction. We breathe out CO2. It's very natural, but we can also use that to separate all the molecules of the property. So our product is using the CO2 extraction. It's the most expensive, and it's the only way if you want to have a high quality. So absorption methods, what's the best way to get it into your pet? That depends on what's going on. I always prefer to have an oral route. Sublingually would be the most optimal option. Sometimes pets won't tolerate that, so if you could at least get it into their GI tract, they can absorb it. They may not get as much as a sublingual, but if your pet, we can tolerate that. We just have you swipe it in the mouth because it's such a small amount of our product. If you can't do that, second best option is to put it on a cookie or a treat, at least of some sort of gets in their gums and stuff like that. Topical application, balms, creams, and patches. Not a big fan of them. I think the oil should be put on directly, not in a cream or anything like that. Our product, we decarboxylate our CBD and make it transdermally absorbable. We're the only CBD that's able to do that right now. Also too, with cats, it's really important. They're very difficult to get CBD to. So our product, because it's only one drop for cats, you actually can take the drop and you can actually rub it in the top 2/3 portion of their ear. It goes straight into their bloodstream and it works immediately. So that gives you another option, and that's why we did that for cats, especially because we have a lot of cat clients and they have a really hard time. And as techs and stuff, we're trying to get killed by them all the time, so I can't imagine what the pet parents are going through. And then the last thing, I'm just going to go over really quickly the 7 things that you should look for in any product. So you should take any product and build this against it. It kind of goes over what we talked about. Lab oil, we want to make sure there's a lab report. We want to make sure low price is a red flag. I know we all want to save money, but really you do get what you pay for in this sense. Only buy CBD products that use CO2 extraction methods, and we already talked about why we should be doing that. Only purchase organic pet CBD, and we talked about that already because, I only buy organic products for myself. I want to make sure there's nothing in it for my pets. I don't want any pesticides, herbicides, and I also don't want anything genetically modified for my dog. So it's really important. And we talked about hemp oil. Hemp oil, be very leery of that. They're using it as a marketing ploy now. Also, choose full spectrum. Never really choose isolates. The studies that are coming out, the way that the isolates are attaching to fatty acids in the liver is going to be problematic long term. So just stay away from them. And then lastly, and least, tinctures, not treats. Treats. The reason why I say that is because all the treats on the market are underdosed by 10 times the amount. So with our product, you can make your pet's favorite treat the CBD. So that eliminates you needing to buy a product that your pet may not like and it may not be effective. And then you can just, it's a fun time. They know they're going to love it. You know they're going to love it, and they're going to get it into them. And then these are just common things that the pet parents that I talk to and work with over the last 10 years have been using CBD for. Joint pain and inflammation, separation anxiety. If you look at our website, we're an all-video testimonial company. A lot of pet parents are moving towards natural products, and that's really what Marina Veterinary Hospital does. They have such an amazing modality. So like, if you, sorry, I lost my bullet. And then here, one thing is really important that we do is, these are all the things we talked about. We want to see a high quality CBD. This is us. I'm sure some of you guys are familiar with Elevet. I'm really disappointed in them. They're a multi-billion-dollar company. They could be doing a better job. They don't even test properly. If you look on their website, they're only testing for total cannabinoids. They don't even test for most of these other things. They have the money. They can do it. Bailey's, Honest Paws, Pet Relief. These are all in the pet stores right now. And as you can see, kind of speaks for itself about the quality of what they're doing. So for Furry Faces, We have calming, mobility, and wellness in one bottle. Most people sell it separately. I think that's a marketing ploy. It's all about dosaging properly for what condition you're working with. We've made the same bottle. There's 4 sizes, but you can use it for all your pets. We don't want you to have to spend extra money. We know pets are expensive. So if you have a cat, 20-pound cat, not 20-pound cat, 20-pound dog. If you have a 20-pound cat, take a picture and send it to me. 20-pound. You have one?
She's always really nice.
That's super cute. I love that. Yeah, so you basically can buy any of our bottles. It'll work for your cat, your dog. It'll save you money. It's only 1 to 2 drops per 10 pounds. As I said, we have multiple ways to give it to cat, the ears. And then also too, we also make sure that we put everything, all the labels are clearly marked for everyone to make sure that they can read that. And also today we're offering a special 15% off for Marina's Veterinary Hospital Day. So anybody that would like to purchase our product or try, we will give you this discount for today. So thank you so much, everybody. Does anybody have any questions? I can answer them. Yes.
So you mentioned doing individualized formulas.
Yes.
So is that something like you consult and
Yes.
people would come to you to do that?
Yes.
Okay.
I have a consulting company where I work one-on-one with patients where I'll get their veterinary records, and depending on their situation, I will make certain things. Because there are other cannabinoids. Have you guys heard of CBC, CBG, CBN? Okay, so we have all of that in our product already. And we also have specialized terpenes for anti-inflammatory properties. So that's what makes our CBD so special. You know, when I was doing this 10 years ago, I saw like what people are doing, what I wanted for my dog, what I wanted for my body, the cleanliness of the product for my pet, and making sure that we had all of the cannabinoids in there that work for your dog or your cat and really improve their life naturally. That's my main option. I've seen pet parents over the last 20 years, dogs on NSAIDs. I've just seen how their bodies decline over the decades, you know? And that's the reason why I'm really happy about working with Marina, because they do acupuncture, they do all of the other modalities that are so important. We're just not using pharmaceuticals. Pharmaceuticals have their place, I think they're important, but if we can do something naturally for our pets to help them and not hurt them, then I'm on board for that, so. Any other questions?
Well, so you do individual consultation
Yes.
and you have off-the-shelf products?
Yes.
And, okay.
Yeah.
And then sometimes you might recommend off-the-shelf products?
Yes.
Or you will formulate?
Yes.
I see.
So we have our product line right now that the way it's made, it has everything that you need for most things. Things that I would make special concoctions for are my seizure patients and my pain patients. Those are the 2 ones that I will make specialized. And there's one client I have right now who's a dog agility champion, and he needed a special CBN, CBG, CBD combination for his muscles and because he was recovering from an injury. And so the CBN and the CBG really helped with the muscle recovery and the relaxation, while the CBD went in and did all the inflammation response. So yes. And if you guys want to see me one-on-one, I do have a website for that as well. And I can get your records from the veterinarian, and I work with the veterinarian, and I update them, and we work hand in hand depending on what's going on. Yeah. Any other questions?
I do.
Yeah.
How do you use CBD, the full spectrum, of course, if your dog is currently on an anti-anxiety medication?
Okay, is that Prozac?
Yes.
Okay, yeah. So you can layer it with Prozac. I've seen that many times. You may have a sedation effect, so you want to watch out for that. A lot of the clients that I work with that are on Prozac, as I said, work with your veterinarian, but what we do is we have them titrate off of it as they're increasing the CBD, and we find that the CBD is actually working much better than the Prozac. You know, it's an individual basis. You know, I can't give you medical advice, but over the last 10 years, I've seen seizure patients that are not working with the medicines work with CBD. I've seen it work in this case. The CBD works better. I've seen the CBD work better than gabapentin most of the time. So a lot of our pet patients, if you go on our website, you'll see like, oh, we tried gabapentin and my dog was like falling off the couch or the whatever, and he was really wobbly, and I wasn't comfortable with that, and they like working with the CBD better. But as I said, it's an individual basis. I don't want to step on anybody's toes, veterinarian's toes, or anything like that. So it's a case-per-case basis. But we're seeing a lot of pet parents choosing this natural alternative. for pain control, anti-inflammatory. And then going back to what the doctors were talking about, preventative. We work with a lot of Frenchies, a lot of Dachshunds, a lot of pets that are going to have down the road problems. We're starting to get CBD in them now for preventative. You know, let's do preventative care. I'm 100% on board with let's get rid of sick medicine and let's get preventative medicine. So that's another reason why I work so much with the CBD is because I've seen pets that are taking it younger. And my personal experience with it is I started my dog on it when he was 6 years old. He's a 140-pound dog. I got him to be 18.
Wow.
And the only reason why he passed away was an unfortunate accident. He was on no NSAIDs, he didn't take Adequan, Doxyquin, or anything like that. He was on our CBD, he was taking type 2 collagen, curcumin, high quality fish oil, and a really good food. And he was getting acupuncture. And that's what made him live to be 16, 18 years old. And I started my product for him, and we only have a short amount of time with our pets, so anything that can help us extend our pets' lives longer, I'm all for it. So thank you so much.
Thank you.